So there's an article over on the Associated Press a couple of days ago that I found really interesting. There's a video from them that we're going to be playing. But it says, Ravages of COVID surge evident inside Missouri hospital. So as you guys know right now, what is going on is a pandemic of the unvaccinated, because the Delta strain that has emerged is way more transmissible. It's way more dangerous. So, causes, more problems, as well as being much more transmissible. And if you do have your double shots, you got both your doses for your vaccine, you have heavy protection against, some studies say that you have really high protection against infection, period. Other studies say that that's lower. The only one I've seen where it says that that's low is the study done in Israel, but there were a lot of structural issues with that study that they did, like whether or not unvaccinated people would be less likely to get tested, and things like having, high vaccinated populations. So that might have been, those are confounding factors to that study. Most studies say, you got 80-something% usually of protection against symptomatic disease, and then usually the infection protection is somewhere around there. But right now, if you are not vaccinated, you get a big boost of protection just from one dose, but once you get that second dose, you really have a massive protection against it. But the thing that's worrisome right now, even with people who are vaccinated, is the longer that this virus gets to continue to go on, the more breakthrough cases there will be. And we didn't used to have the Delta variant that came out of India. So as these variants continue to grow, they can become more transmissible. They can become more, they can become stronger, break through the vaccines. So that's a huge reason as to why it's so important to get everyone vaccinated now. But there's this video of this man you can see. This is the man. He's struggling to breathe. You're going to see in the video. And he was given like a 20% chance to live. And he's going to say that he stayed away from the vaccine because he was in a strong conservative family. So go ahead and check this out.
In Missouri's Lake of the Ozarks, few signs of the coronavirus linger. Businesses lure in tourists eager to resume their pre-pandemic lives.
Hey, babe.
But life here has halted for Billy Barker.
I didn't think you would make it.
She spent the past 17 days camped outside Lake Regional Hospital with her 6-year-old son, Brody, watching helplessly as her husband battles COVID-19.
Him being able to see us made him fight more to be here.
When you take a deep breath in.
Daryl Barker is 31. With no pre-existing conditions and given a 20% chance to survive by doctors when he came into Lake Regional struggling to catch his breath.
It was the hardest thing I've ever to do because I couldn't break a promise to my wife and my kid, but there was a lot of times I wanted to quit.
As the Delta variant spreads, ICUs across Missouri are filling up. Since the beginning of June, hospitalizations have more than doubled across the state. ICU admittance has more than tripled.
A lot of people who are very sick and are dying.
And they're younger. 50% of Lake Regional's COVID patients are under age 59.
So younger population who are not vaccinated, they become very sick, and the mortality in that population is high too this time around.
Before coming down with COVID, both Daryl and Billy chose not to be vaccinated. They said they were worried about all the unknowns, but 3 weeks here in the hospital has changed their minds.
I was strongly against getting the vaccine just because we're a strong conservative family. But that little boy out there is a reason to have a vaccine.
In the first 22 days of July, 23 COVID-positive patients died here at Lake Regional. Most were unvaccinated.
Any side effects that you're going to have from being vaccinated are way better than having to do this.
When Daryl will be released is still unknown. And until he is, Billy and Brody will sit at his window, separated by glass.
I'm that little boy's hero. I'm supposed to be the strongest person he knows. Right now, he could come in here and he could take me.
The virus pausing a family's life as so much of the world continues on without them. Sarah Blake Morgan, The Associated Press.
So as you can see, he was somebody who was anti-vaccine. I would definitely say that the idea of like staying away from the vaccine because you're from a strong conservative family it just seems like really like such a stupid idea and just such a dumb mentality that I think if you're in that position, you need to rethink that entire mentality. The idea that strength comes from staying away from a vaccine is just so toxic and so stupid. It's like this idea that somehow wearing masks is like not masculine or something like that. Like exposing yourself to viral diseases that there are no cures for is masculinity. No, that's just pure dumbassery is what that is. So it's so stupid. It's so dumb. It's incredibly stupid. But, you know, he is now saying that, yeah, I would take the vaccine. I also had done a video about a story where a doctor in Alabama was basically saying, you know, COVID patients in the ICU on their hospital beds are basically, they're close to death. They don't really have breathing power, and they're asking for the vaccine, but that's not going to work. Vaccines you need like 2 weeks, I think, per dose for it to do anything, and I believe that's basically across the board for all vaccines. Your body needs 2 weeks for the antibodies to form and to develop that memory. So, you know, don't be like this guy. Make sure to get vaccinated. The more people that get vaccinated, we can go back to normal life. We can avoid unnecessary deaths. It will protect society as a whole. Think about it as society as a whole. It's not just about you. It's an extremely transmissible disease. And not only that, even if you're vaccinated, right, you are still at risk, because the more that people do not get vaccinated, the higher chance that a vaccinated person has of breakthrough cases and potentially a situation in which maybe you need a whole entirely new vaccine just to protect against some new strain that develops, because, you know, the Delta is way worse than any of the other Gamma or Alpha or whatever. I don't know if there's the Beta one as well. It's way worse. So that's why getting vaccinated is so important. It went through its trials. It did get emergency authorization from the, you know, FDA. There were no long-term side effects. So it does not alter your DNA. It has nothing to do with your DNA. And there's just none of that going on. So I don't know whether you want to take the risk with something extremely transmissible like COVID that you could definitely die from. And what's really concerning is you're seeing now, this is the danger sign of any disease, is when younger people start showing up in hospitals in the ICU. And death rates are starting to go up amongst young people. That's when it's like, oh shit, because that's what happened with the Spanish flu. Once that happens, it's danger zone time, essentially. So that's why getting vaccinated is so important. We got to prevent the spread and the proliferation of the virus to stop, you know, any potential improvements in terms of, you know, danger and damage that, you know, the virus could do.